I was in the most terrible back pain, and I went to a doctor. He referred me to a surgeon, and they did an MRI scan, and it showed like a couple of bulging discs. And their first solution was like, right, we'll just go in and do a discectomy. We'll just go in and cut
Yeah.
those bits of bulging disc
Hmm.
out. And like at the time, I was like, that seems pretty severe. What are the repercussions for this? And they were like, oh, there's a small chance we could, fuck your spine up and don't walk again. And and like we might screw up the discs. So, we might have to fuse the
Yes.
vertebrae, and then you'd have
Hmm.
seriously limited mobility. And I was like, hang on, I'm 18. And luckily at that time I came into contact with a strength coach who just showed me, proper technique and showed me some great exercises for it. But incredible that someone there in a position of authority was happy to get a knife, under these medical terms, like get a knife and basically cut me open into a incredibly important area of my body, into my spine, and perform a surgery that now looking back would have been totally unnecessary. And like, how many people are having that done now, like as we speak, are being told by doctors, referred to a surgeon because they can't get rid of a pain, and then cut open all of those resources, like, and all of that ensuing pain down the line. It's just incredible.
Yeah. Yeah. And I think it's probably one of the reasons why someone like you and I are having this conversation, um, because the medical world is really, really failing us on a greater level. Um, I mean, since like the late 1990s, like 1998 to now, there's a 400% increase in the amount of people that are getting spinal fusions. Like a
Wow.
400% increase. It is like the amount of people over the 300,000 every single year. I think 350,000 was the one I saw that people are getting some kind of spinal fusion, whether it's cervical, lumbar, lumbothoracic, or something. And so you were talking about it, discectomy or whatever, like where they go and kind of clean up the discs because it's protruding just a little bit, which is pretty minor. And some people have had some nice relief from that. The main one that is prescribed is spinal fusion
Mm,
surgery,
mm,
which is to me is crazy. And it comes from this idea that I don't really prescribe to, that if we remove movement from the body, it's going to be pain free. If we limit its ability to move, if we put a metal cage in the
mm,
spine, it's going to protect it. But I mean, you do one quick Google search on some different studies they've done on any kind of spinal fusion, and the success rates are anywhere from like 50 to 60%. But then you also say, well, what does a success rate mean? Because 50% of the people who get a spinal fusion still experience back pain. There's a higher chance of opiate use. There's a less chance that you're going to have an easy return to work weight. Like, so people are getting told to do this, and it's because of the way that we've allowed ourselves to think about this as something to solve. And you go into the doctor, so somebody's experiencing pain, and it says go to the doctor because the doctor is going to tell you what's going on. The doctor is supposed to know why you're experiencing pain. The doctor doesn't know, so he does his imaging, he does his MRIs, or he does an X-ray, and just like you, he sees some kind of physical abnormality, bulging discs, a little bit of scoliosis, a little bit of degeneration, whatever it is, and says, oh, wow, you got some bulging discs. You got this scoliosis. That must be the reason why you're experiencing pain.
mm,
But also statistically around the world, there is a humongous percent of the population that does have scoliosis,
mm.
that does have bulging discs, that does have some kind of degeneration in their spine and is completely asymptomatic. So
100%.
there's no real correlation between what these MRIs and X-rays are showing us into what we are experiencing on a daily basis. So for then a doctor to say, well, there is no correlation, but there is this symptom present, and I'm going to prescribe to you, or I'm going to recommend, or this surgeon's going to recommend that what we're going to do is put a cage around. It's like one of the only surgeries that we do that is only designed to try and alleviate a symptom.
Mm.
Like your back surgery is trying to alleviate the symptom and trying to quote unquote protect you from further damages down the line. Now, and there's only 5 to 7% of people they actually have what they call a pathoanatomical reason for why they have pain. They do have a tumor in their spine that needs to be removed, or there is a nerve that is actually like getting messed up, or completely like a vertebrae is completely out. It's like 100% go in there and fix it. But that's 5 to 7% of the population. So like 80, anywhere from 85 to 95% of people that have back pain, they just call it non-specific general low back pain. And surgeries is one of like the biggest things that we prescribe. And to me, this information is really important to get out there, because when you are in this situation with back pain and you are looking for answers, everyone tells you, if you're sick, go to the doctor. But the doctor is part of this thing that has been emerging since the early 1900s, when we started developing these surgeries. That's okay, we do some imaging and then we go this route. And that's just kind of like they're okay with that. And we're supposed to believe that, number one, it's normal to have back pain. Number two, that having back surgery is not a big thing, because oh, that guy has back surgery, my neighbor has back surgery. It's like whatever. I feel like, oh yeah, my back, and I got back surgery, and they still have spasms. They still have things going on. And when you talk to somebody about back pain, like to me, as somebody who's been a mover, I've had 2 instances in my life where back pain like debilitated me to where I couldn't perform. And by the end of the day, they were gone. But the first one was when I was boxing, and I was boxing with my boxing coach. We were holding mitts, and we were doing like a 1, 2, 3 slip 2, but we were doing it just like over and over and over again. So I was in this hunched over position going 1, 2, 3 slip 2, whatever. And the amount of times that I was slipping, just flexing my spine and putting it out there, my spinal erector is just like, they did that thing where they just locked up and they're like, da, 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 da. And then the same thing happened when I was doing a CrossFit workout, heavy kettlebell swings, like a lot of kettlebell swings. So, so many people are going to be experiencing some kind of back pain. And we have this general thing that it's like normal.
Yeah.
Or